Hi, my name is Ivy, and I am one of the oral health therapists here at Ocean Orthodontics. Today, I will be showing you how to clean your teeth and braces during orthodontic treatment. Not keeping them clean can lead to tooth decay, gum disease, and even permanent stains, things we really don't want. So let me show you step by step how to keep your teeth and braces nice and clean to achieve that perfect smile. So we tend to recommend either an electric toothbrush or a manual toothbrush. Either is fine, it's totally personal preference really. The brand also isn't so much a concern to us, so long as you're using the correct technique. Yes, there is a totally different technique between the two of them. So let me show you the areas that you need to focus on when brushing your teeth and the most commonly missed areas. So you want to make sure you are brushing the margin where the tooth meets the gum line. This is a really common area that a lot of people tend to miss. So using an electric toothbrush, we want you to gently move this around so that you can feel the bristles actually tickling the gums. When you miss this area, you'll find that your gums will get puffy and red and sometimes even bleed. So it's really important to get that toothbrush in there and give it a good clean. You'll notice with the electric toothbrush, I'm moving it around really slowly. This is allowing the electric toothbrush to do its job. So remember to do the top and bottom teeth, as well as the lip side and the tongue side. You also want to focus on the biting surface of the teeth. You'll find that in these grooves, especially in the molars, a lot of food will get stuck. So remember to do the exact same thing for the top as well as the bottom teeth. In terms of the braces, you want to get an angle on the toothbrush, about 45 degrees. There are grooves in the top and bottom of the braces, so you'll find that a lot of food and plaque does get stuck in these grooves. So that's the top, and do the same thing for the bottom of the braces. The technique when using an electric toothbrush versus a manual toothbrush is very similar. The main difference is with the manual toothbrush, you will need to just scrub the teeth a little bit more in order to remove any food and plaque. So when using a manual toothbrush, we still want to aim towards that gum line where the tooth meets the gum. But instead we're going to be using small circular motions for the top and bottom teeth on the lip and cheek side, as well as for the tongue side. Remember to also do the biting surface of the teeth. Now with the molars, a lot of food tends to get stuck in these back grooves, so really important to give a really good scrub back and forth. All the way around up the top and then the bottom. For the braces, we still want to get that 45-degree angle, scrubbing back and forth so we get in that top groove of the braces, as well as the bottom groove of the braces to get rid of any food and plaque. So remember to do that for the top and bottom braces as well. So regardless of whether you use a manual toothbrush or an electric toothbrush, it's really important to brush them morning and night for 3 minutes. When it comes to choosing a toothpaste, we don't have a preference to any particular brand or company. The main thing to look for when choosing a toothpaste, however, is one that contains fluoride. Fluoride is actually really important in protecting your teeth against acid wear, fighting off bacteria, and keeping your teeth healthy and strong. When brushing your teeth, what we're trying to do is break up that sticky, furry film of bacteria that's on our teeth. It's what we call plaque. So the longer this plaque stays on your teeth, the more bacteria actually accumulates on it, and this in the long run can cause bad breath, the tooth decay, the gum disease, and the permanent stains that I mentioned before. So it's really important to not only use a toothbrush to remove the plaque, but also products like floss and interdental brushes, especially when you're in braces. Flossing can be quite tricky to use, especially when in braces. However, I will show you a few tricks I like to use to make life easier. So rather than using your standard string floss, that is harder to control because it's so soft and flexible, we tend to recommend one that has a floss threader on the end. There are 3 sections to this floss: the standard floss end, the fluffy section which helps you to collect food and plaque from around the braces and in between the teeth, And then the floss threader end, which you can see is a lot stiffer and allows you to direct the floss much easier. So leaving about 1 centimeter, holding it in between your thumb and pointer finger, allow the floss threader to run along the wire while you're pulling your lip out of the way, and when it flicks you on the gum, push it straight back up. Pull it all the way through, and I like to use the fluffy end, and wrapping it around both fingers, wriggle it in between the teeth. It'll pop through, and then wriggle it up and down one side of the tooth and under the gum. Same thing on the other side, and then you can pop it out. We also have platypus flosses available, which many patients have found slightly easier to use and made especially for patients with braces. You will notice a thin end and a thicker end. The thin end actually goes between the tooth and the wire. So gently wriggle the floss in between the teeth, and then wriggle it up and down one side of the tooth underneath the gum, the other side of the tooth underneath the gum, and then you can pop it back out. So remember, while you're in braces, it's really important to brush your teeth for 3 minutes in the morning and 3 minutes at night. With the floss, we need you to at least floss at night, just to remove all that food particles in between the teeth and the plaque underneath your gums. We do get a lot of people ask us about water flosses. They are a fantastic tool to remove large food particles from around the braces and the teeth, but they don't remove food particles and plaque that are stuck in between the teeth or underneath the gum. So unfortunately, the answer is no. It's just not a replacement for floss. This is an interdental brush, which we recommend to all our patients in braces. It has bristles like a toothbrush and is fantastic at cleaning between the braces underneath the wire where the toothbrush just can't reach. In order to use it, I like to bend it on an angle for easier access, place it underneath the wire, and wriggle it from side to side, up and down on either side of the braces. So on this side, then the other side, and then popping it out. Same thing with the bottom. Aiming it down and wriggle it on the left-hand side, and then the right-hand side, and then popping it out. These are disclosing tablets. These are really good at showing you how well you've cleaned your teeth. So after brushing, flossing, and using all the products that I've mentioned previously, pop one of these tablets in your mouth, give it a good chew, and swish it around for about 30 seconds. Rinse them thoroughly with water. Any remaining plaque left on your teeth will be either highlighted pink for new plaque, which is formed today, or purple, which means that you've missed that area for a few days because that's now old plaque. So these are all the products we recommend our patients when it comes to keeping the teeth and braces nice and clean. They can all be found at your local shop or at our practice. So let us know the next time you're in if you're looking for any of these products, and we hope to see you again soon.